great. And we're going to go ahead and start. So thank you, everyone, for joining us. Today, we will be defining care management and discussing how your practice can leverage team-based care to deliver better care for your patients. Please feel free to chat in comments and questions during the presentation, and questions will be answered at the end of the webinar.
You entered the call today unmuted. As Tammy mentioned, you can use the controls at the bottom of the WebEx to mute and unmute your line. We do welcome chat and questions, of course, during the presentation, but please use the chat box to type in your questions or comments throughout the session today.
All right, and I forgot to advance the slide, so sorry, Gary. So a little bit about this series. Each session will be no more than 30 minutes long, as we know that time is a precious commodity. Each session will have time at the end for open discussion and questions. Because this is a small bite series, we will cover 1 to 2 foundational elements of practice transformation in each subsequent session. By taking small bites with each session, this will allow you to take small incremental steps in your practice. This series is designed with the small practice in mind, knowing that you have limited personnel and financial resources. These are the steps in practice transformation. These steps are not in a particular order. They're all done simultaneously. However, knowing who your patients are is the first step. Now, don't let this list scare you. It's important to note that your practice could implement only a few of these steps and still effect change. It's not all or none, but the more invested you are in the change, the more impactful your outcomes will be. Today, we will cover care management and team-based care. Previous webinar recordings are available on our website. As we advance in this webinar series, we are working towards the Quadruple Aim, particularly better outcomes at lower cost. Just a reminder that lower cost does not mean less care, just care in the right setting and at the right time. If we improve outcomes, then long-term expenses should decrease. So let's start off with some definitions. You can see here the definition of care management. Care management is all about the communication and support you provide to the patient outside of your office visits. Team-based care allows everyone to practice at the top of their license so that providers can do those tasks that only a provider can do. And licensed nursing staff is not doing tasks that non-licensed staff could be doing. We will be looking at different levels of care management today. The goal of care management is to help patients better manage their health in order to avoid ED and hospital stays. If you provide care management to rising risk patients, you can also help prevent progression of their chronic illness. Care management is a resource-intensive activity. Since practices have limited staffing and financial resources, we will explore how you can use team-based care to ensure that staff are performing duties that are the most appropriate for their training and skill set. Now, we will talk about the different types of care management. First off, let's see how many of you offer care management services already. So I know we've got 2 practices on the phone or on the line, so I'd love for you to chat in if you currently offer care management services to your patients. Okay, Vicki does, good. And Vicki, we may have some follow-up questions for you later. And David does for some of their patients. Perfect, so you guys do have some working knowledge of care management. So hopefully we'll help you learn a little more. So there are 2 basic kinds of care management. The first is episodic care management. This is a short-term interaction with the patient after a transition, such as a hospital or ED discharge. This contact is intended to ensure that a patient has all the resources and education they need to prevent a return ED visit or a hospital readmission. You'll find that this kind of care management is really geared more to resource coordination rather than disease management. Longitudinal care management is designed for patients with chronic disease or other high-risk diagnoses. This is a long-term relationship between the patient, the care manager, and the care team. It is designed to help that patient live their best quality of life and manage their condition well enough to avoid ED and hospital admissions. Patient goals and preferences are vital to this process, as patients who are working toward a personal goal are more likely to succeed. Now let's look at some examples of patients in episodic and longitudinal care management. Patients that are appropriate for episodic care management are those that need some short-term contact to ensure they have the resources they need. In the case of patients discharged from a SNF or a hospital, that care management could consist of follow-up phone calls and coordination with home health or other home services to ensure the patient is safe at home and have the resources they need to prevent a readmission. In the case of a patient who is discharged from the ED with oxygen, it's important that they be followed up on to ensure they know how to use the oxygen correctly and safely so they get the full benefit and don't actually deteriorate. In the case of a patient with insurance, it's important to assist them in obtaining their medication so that they can maintain their health. As you think about existing staff that could do this kind of care management, it does not have to be a licensed nurse. It could be an MA or a CNA, or even someone who has worked in your office for a long time and who has knowledge of local resources. This is really a great way to dip your toes into care management and see how you could impact readmission rates by doing some dedicated episodic care management. Patients who would benefit from longitudinal care management are those patients with more complex needs. In this example, you can see that these are patients with a new diagnosis, an uncontrolled diagnosis, or patients with high ED utilization. We will discuss how to prioritize patients for longitudinal care management soon. As you think about how to deliver longitudinal care management, you need to consider that a care manager for this type of work really needs to be in the nursing or social work fields. They should have experience in managing patients with complex needs. In a perfect world, this would be a dedicated staff member. However, in reality, your practice may just want to care manage a few patients and just reallocate some time from an existing nurse or social worker in order to do that. Now, you can't care manage every patient that needs it. Since this is a resource-intensive activity, you must prioritize what patients you will outreach to. So looking at episodic care management, not every patient who's discharged from the hospital will need episodic care management. For instance, if you had a patient who had an appendectomy, they may not need any episodic care management. They may need just a follow-up phone call from your office to see how they're doing, or if the surgeon routinely follows up with them, you may not need to reach out at all. An ED visit for a fractured wrist likely also won't need episodic care management. However, you could consider maybe sending a portal message to just check up on that patient if that's an option in your practice. The patients that will need episodic care management are those that are discharged with new equipment or medication or need some kind of support with community resources. When we think about longitudinal care management, this is exceptionally resource intensive. So where do you start? You could consider patients with hemoglobin A1C above a certain threshold, patients with multiple hospitalizations, those with multiple comorbid conditions, or you could rely strictly on provider intuition and referrals. So let's talk a bit more about the episodic care management process. It is very linear. For instance, there's a referral or an event. A referral can be made if a patient needed assistance, say with obtaining food or maybe rent and utility assistance. Or they had an event such as an ED visit, as we've been discussing. Next, the care manager or designated staff member helps that patient with needed resources, such as a referral to a food bank or maybe making sure they have all the equipment and services they need after an ED visit. Once those needs are met, there are really no further interventions unless the patient has a new need. In contrast, longitudinal care management is an ongoing collaborative relationship. Once you've identified a patient that would benefit from longitudinal care management, either through reports or a provider referral, you will communicate with that patient to build rapport, because this is a relationship built on trust. As you develop a relationship with that patient, you'll be providing ongoing education and interventions as needed, and then continuously monitoring patient outcomes. Note that this is absolutely not a linear timeline. It's a cycle. You'll continue this cycle with this patient until they're able to manage their condition without your extra support. This could take months, years, or honestly never end. The goal, of course, is for patients to graduate from longitudinal care management, but we know that's not always realistic. You may always have to have contact with that patient outside of office visits in order for them to manage their condition. Now, before we talk about implementation, let's see how many of you already conduct follow-up phone calls. So I'm going to open a poll, and if you guys will just answer. Hopefully a poll popped up on the screen. Not done this before.
It did, and it looks like they both answered.
Okay, perfect. Okay, so it looks like we have one that answered ED visits. All right, perfect. I'm going to go ahead and close the poll. Thank you for that. So let's talk about episodic care management. Episodic care management is generally a bit easier to implement and not as resource intensive, so that's a really good place to start. First, establish how you will ID patients that need a follow-up call. For instance, how do you get discharge notifications? Do you need to reach out to your local hospital to establish a process to receive those, or do you have a process in place already? What about EDs? Do you know which of your patients have been to the ED and why they were there? Now, remember the active patient list we talked about in the last session? Here's where that comes in handy. A patient may tell the hospital or ED that their primary care provider is in your clinic. However, if you haven't seen them in the last 2 years, are you really their primary care provider, and do you really need to follow up with them? So again, that active patient list really helps you decide which patients you're truly responsible for. And you can find that recording on our website. As a rule, all hospitalizations should be followed up on in an attempt to reduce readmissions. If you conduct a telephone follow-up within 2 business days, followed by a moderately complex face-to-face visit within 14 days of discharge, you could be eligible to bill for CPT code 99495, which is Transitional Care Management Services. Because your practice will likely have more patients with ED visits than hospital stays, it's important to prioritize who you will call for that ED follow-up. Certainly, high-risk conditions should receive a call, such as a CHF or COPD exacerbation. However, patients who have multiple ED visits could benefit from a follow-up call if for no other reason than to educate them about other options other than visiting the ED, such as calling your office first, after-hours walk-ins, or urgent care facilities. Once you know who needs to be contacted, the next step is to decide how your practice will reach out to those patients. This is where team-based care comes in that we'll be discussing soon. Keep in mind the differences in skill sets needed for episodic versus longitudinal care management when deciding how you're going to do follow-up calls. If more than one person is doing follow-up, then it's a good idea to keep a spreadsheet or shared file so they're not duplicating the work. It would also be a good idea to develop a script so that each patient gets a similar follow-up and that those making those calls have a starting point for their conversation. And this is something that our organization can help you to develop. Longitudinal care management takes many more resources. Therefore, you want to ensure that you are targeting the patients that will benefit the most from some extra interaction and support from your team. One way to start with a small group of patients is to ask your providers who they think will be hospitalized in the next 6 months. And trust me, they're going to be able to rattle off a few names without any thought at all. Discuss with the provider why they think this patient's at risk for hospitalization so you can get some insight into what extra support would benefit them. Now you can conduct proactive outreach. Patients may be skeptical at first because they're really not used to practices reaching out, offering to help them. One way to mitigate this is if you tell them that, hey, your doctor wanted me to call and talk to you. Of course, if you utilize current staff member, the patient may already know them and be very open for discussion. The support you provide will be based on the patient's needs, but it really revolves around helping the patient to better manage their health. You can do this by providing patient education, resources, and referrals, such as behavioral health, social services, and other referrals. And remember that this is an ongoing relationship, so you won't just be making one phone call and call it done. You may talk to a patient every couple of weeks at first just to get that rapport established, and then taper down to monthly or so. You also want to ensure that they know that they can call their care manager to see if they need to come into the provider for an exacerbation of their illness. Many times, an illness exacerbation can be handled without an office visit, or they can be squeezed into the schedule to avoid an ED visit. So one of the areas that KFMC's tailored consultation services can assist you in your practice with is in setting up processes for identifying patients, tracking progress and policy process changes, and developing and implementing measurement strategies. So let's talk about ways you can measure your success in care management. If you've implemented follow-up phone calls, you could track the rate of follow-up calls for a few months. Your rate would be the number of follow-up calls you did divided by the number of discharge notifications you received. Now be sure when you calculate this rate that you're looking at a discharge date window to ensure your calls are timely. For instance, maybe set a goal of ED follow-up calls within 7 days and inpatient within 2 business days. You could also look at the rate of patients you called that had a repeat ED visit or hospital readmission versus those patients that did not receive a follow-up call. If you implemented longitudinal care management, you could track quality measures of patients in longitudinal care management versus those that are not. For instance, are hemoglobin A1C levels lower in patients who receive longitudinal care management than those that don't? Or you also could look anecdotally at how many ED visits or hospitalizations you have avoided by having additional contact with patients and better managing their chronic conditions. Now, let's dig a little deeper into team-based care. Implementing care management seems like a huge task, but by utilizing team-based care, you can better allocate your staff resources. Team-based care acknowledges all the players involved in achieving maximum health for your patients. Of course, the patient is a central member of that care team. And the care team consists not only of the primary care provider, but also other members of your care team within your office. And we can't forget that there are care team members outside of your practice. Those include other medical providers, such as specialists in hospitals. And another member of the team that we often forget is those community resources, such as community health workers, food banks, and senior centers. Everybody in your community plays a role in the health of your patients, and the population must all work together to achieve the best outcomes. As we reflect on the last slide, we can see that there are many members of the care team outside of your office walls. We're going to focus on them in the next session. Let's focus just on those inside your office for today. To achieve team-based care, we must acknowledge all of those key players in patient care and work together to achieve better outcomes. This includes both clinical and non-clinical team members. Your front desk staff should absolutely be considered part of your care team as they interact with patients long before their visit. As stated previously, the goal of team-based care is to utilize the highest skill set of each team member and that every team member practices to the top of their license. As we discuss examples of team-based care, keep in mind that team-based care can save clinicians time by shifting some functions to non-clinical staff, which equals improved provider satisfaction and can lessen those feelings of burden by providing more time in the day for things that only clinical staff can do. As you think about team-based care and everyone using their highest skill set, consider who you have on your team that's calling patients to close care gaps. So is that an RN or an LPN? And is it really necessary to have a licensed nurse calling patients to remind them of mammograms or schedule them for an office visit for a blood pressure check? Who else in your practice could you leverage for that? If you are already conducting follow-up phone calls, who's doing them? Is there a potential to delegate some of those to other staff members? This slide demonstrates examples of workflow changes that your practice could implement to allocate your resources more effectively. Now let's look at changes in workflows that could lead to more provider and nurse time. If your office is doing annual wellness visits, you know that they're very time-consuming, and the bulk of the visit is in the health risk assessment. If your providers are doing that entire visit, consider having another care team member conduct the health risk assessment. Then the provider can spend time with the patient addressing areas of education and advice, and perhaps they would even have time to add advanced care planning to that conversation. Advanced care planning can be billed as an additional service and is CPT code 99497. Additionally, if the provider and nurse handle all communications with that provider's patients, consider how you could restructure your care team. For instance, could the provider's nurse just reach out to patients to follow up on office visits, such as calling with lab results or instructions? And then closing care gaps and ED follow-up calls could then be delegated to other dedicated staff who does that for all the providers. So again, this is an example of workflow tweaks that you could do in your office. So the first step to implementing team-based care is to really evaluate what each team member does. And honestly, they probably all do tasks that they don't even realize they do. So basically, have everybody record what they do in a day, or have them do that for a week. So then look at what they do in a typical day and look at the workflows involved and see what opportunities exist to maybe allocate duties to non-licensed staff that licensed staff is doing. Again, going back to, do you really need RNs or LPNs calling all patients for reminders of lab work? That's just one example. Then decide on a small change you could implement and trial it maybe with just one provider. This is a great time to do a PDSA, which is a plan, do, study, act exercise. And this may seem like a daunting task, but our team can help you to evaluate your workflows and identify those opportunities for improvement. And of course, we're always happy to help you with the PDSA. So how are you going to measure success with team-based care? If you choose to change the way that you reach out to patients to close care gaps, evaluate how many patients have a certain gap before you start compared to a month later. And has the change in contact led to a decrease in the number of patients with that care gap? Or what percentage of patients you contact actually get that care gap closed? You could also evaluate staff and provider feedback. How is the change working for them? Do they feel like they're spending more time doing only what things that they can do versus other tasks? And if you choose to change how you conduct annual wellness visits, look at how those are going. Is the documentation more complete? Is the provider able to provide more education since someone else is conducting that health risk assessment? And are there more advanced care planning conversations happening? So as you return to your workday, consider these next steps. First of all, evaluate how your practice can implement care management. Analyze the role-based workflows in your clinic for opportunities to leverage your staff resources better. And then take one action to implement team-based care. And then reach out to Gary and I for assistance because we are happy to help you. We absolutely love this kind of stuff. So with that, I'm going to close the presentation and I'm going to open it up for questions. I wonder if anyone has any questions they'd like to ask or any discussion?
Nothing yet.
All right. So Vicki and David, you both indicated that you do some kind of care management. So Vicki, what do you do care longitudinal or follow-up phone calls? I'm kind of curious what you do for care management.
So I'm the director of the Cancer Center, and I see all the medical oncology patients with the oncologist when he's here 1 day a week. So I do care management, kind of longitudinal, but also some episodic, not necessarily after discharge from the hospital or the ED, but someone that has just been diagnosed. So we're getting a lot of things rolling. So I'm doing a lot of communicating with them, calling, following up with them about different appointments that they have, kind of a navigating sort of thing, and educating them. And then helping make sure that they get their medications, that they have the financial things in place to get started on their chemotherapy. And then after their first chemotherapy, I usually do a follow-up phone call just to see how things are going a couple of days after the first treatment, and then kind of back off and they call me if they need to. But I develop that relationship early on with a new diagnosis, and then kind of fade off a little bit, but they still have my numbers to call. And then someone that is having, maybe they call out of the blue and everything has been fine. And then if they call with a problem and I give them some solutions, then I always check back with them again to make sure that those have worked and been successful with them.
That is awesome. And I love how you make sure that they get off on the right foot once they're diagnosed. I know years ago my mom was diagnosed with breast cancer, and I don't remember her having a contact person. So just having that person that you can call in the clinic who's looking out for your best interests, I think is huge, and definitely helps with peace of mind and making sure nobody falls through the cracks.
Right.
So thank you. David, you had indicated that you do care management for some of your patients. You want to share kind of what you do? You are on mute if you're trying to talk, David. There you go.
Sorry about that.
That's okay.
Yeah, in addition to following up with our patients after a hospital or emergency room stay, we do some chronic care management for our care management for our chronic care patients.
All right, great. Thanks for sharing that. So I'm the practice transformation manager here, and Gary is our health IT specialist. And really what we do with practices is really help you to look at your care management processes and ways to make it more efficient and more robust. So if that's something you guys are interested in, please reach out to us, and we would be happy to work with you to kind of build that capacity. That's something I'm very passionate about, coming from a hospital case management perspective. So yeah, just keep us in mind if you're interested in some future assistance with that. Either of you have any questions before we move on to close out this session? All right.
I do not.
Okay, perfect. Thank you. Let me advance my slides. All right, so again, we love to assist practices in practice transformation. And just to note that our consultation services are free if you're contracted with at least one of the Kansas Medicaid MCOs. So if you bill any Medicaid services to any of the 3 MCOs in Kansas, we can provide free consultation services to you. If you're not contracted with an MCO, we do have very reasonable fee-for-service rates as well. And Gary is going to chat in our website. He already did. He's way ahead of me. This is where you can find recordings of our first 2 sessions as well as the slides, and also more information about the services that we provide. And then our next session is going to be November 17th. So we're going to be discussing on that session how to improve collaboration with other providers. And we talked about, kind of the other care team members that are outside of your office, and also how to engage patients in their own care. So again, I'm Tammy Elliott, the Practice Transformation Manager. Gary, who is monitoring chat, is our Health IT Consultant. And Gary is going to post a survey link. We really want you to take a couple minutes. It'll take like literally 60 seconds to complete. We do read those, check those surveys and use that to develop future events, and we really do value that insight. We will be posting the slides and the recording on our website, and when we do, we will send you links, direct links to those, so you'll be able to access them and share them. And so with that, we will conclude our webinar today. Thank you guys all so much for joining us, and I hope it was beneficial.
Thank you.
Thank you. Have a great day.
You too. Bye.